The Voices of Acromegaly, a 360-degree look at the condition. Part 1, a look at acromegaly, living with the reality. Unusual enlargement of certain body parts, including hands, feet, forehead, and jaw. Frequent headaches. Visual defects, excessive sweating, sleep apnea, joint problems. These are some of the classic symptoms of acromegaly. Acromegaly is a rare hormonal condition caused by a non-cancerous pituitary tumor that leads to excess growth hormone and insulin-like growth factor 1 in the body. Acromegaly can be difficult to diagnose, and people often struggle for several years before receiving an accurate diagnosis. While the acromegaly journey to diagnosis may vary, there are certainly some common themes that are important to share to help currently undiagnosed patients. Listen to this collection of stories of people who were living unknowingly for years with this debilitating disease.
I think it started in about late 90s, early 2000s. Started to complain of various ailments, went to multiple doctors, and basically everybody was looking at the individual symptoms and not looking at the whole picture.
Well, the first sign I noticed was the visual field loss, but when my endocrinologist told me to bring all the pictures from the past and just bring everything from in chronological order, he said probably my acromegaly started in the age of 19. And I didn't really notice because first of all, the facial change is gradual and I see myself every day and I couldn't see the really small change every day.
Well, I will talk about my brother. His name is Dmitry. He is now 43 years old. And he was sick since he was something like 20 years old. And we relatives would notice some differences, but we didn't know what was the problem.
So mine started probably in the age of 19, starting with the height and then the facial change. And over 2 or 3 years, I figured that my feet was growing and my shoe size increased from size, that's an American size, but 8.5 to 9.5. And my hand also got bigger. My ring size got changed.
I had skin problems, acne, I'd sweat a lot. Just strange things, like I could actually pick a hot potato out of the oven without oven gloves and not burn myself.
So my doctor, neuro-ophthalmologist, ordered a couple of testings, including MRI. And a week later, I was called from the doctor's office saying they want to talk about MRI result. And they found that I had a tumor in the pituitary.
When I was first diagnosed, they did send me to this endocrinologist who was the expert in Canada, actually. And he looked at my profile, he looked at my case quite, individually. He basically said that the best treatment would be surgery.
Well, at least from the experience of my brother, the highest kind of emotional effect was when he was diagnosed, because it was very positive, because you just understand at some point that this was not your problem, this was a disease.
The timing of my diagnosis was, in many ways, it was good timing, and I would say that my life has been enriched by it.
An acromegaly diagnosis can be difficult to come to terms with. It is important to identify symptoms as early as possible to quicken time to diagnosis. Please visit acromegalyinfo.com in the U.S. or aboutacromegaly.com outside of the U.S. to learn more about the disease and acquire supportive resources and materials.